Hi, I'm Anthony Newbold. Welcome to A Closer Look as we continue to unpack the aftermath of Dorian. My guest this week is the Chief Medical Officer of the Bahamas, Dr. Pearl McMillan. Dr. McMillan, welcome to the show.
Good morning, and thank you for having me.
You are the Chief Medical Officer of the Bahamas. That means what?
Well, the Chief Medical Officer is a senior official in the Ministry of Health, a physician, and that person has responsibility for medical services and also for advising and being the lead on all public health matters.
And so Dorian hits. You're the Chief Medical Officer. What does that mean for you as the Chief Medical Officer?
As the Chief Medical Officer, certainly, there is ongoing preparedness for any event that could potentially have, negative health impact on the population. So Dorian hits, and we have to, move into action. But what I would say is, hurricanes, we are used to hurricanes. There's a hurricane season every year. So our planning actually begins, early on in the hurricane season. What we do is just ensure that all of our healthcare facilities are fully assessed as it relates to structure, med-surg supplies, all those things that we anticipate will need to be in place and solid should a hurricane actually come. As Dorian came, we just moved to ensure that we were able to mobilize now and support the response.
It would be fair to say that any advice that you may have is critical to, I want to say the ministers, but the government's decision making. Whatever the government makes, decision the government makes with respect to health services, it is critical for them to get advice from you.
That would be fair to say. A chief medical officer should be well versed as it relates to, the health systems in the country, the health services in the country, all things public health, that being global, regional, and national. And so advice given would be along the lines of those things. And I would say it would be fair to say that that is the kind of advice that is often given from the Office of the Chief Medical Officer.
Yeah, and of course, we're talking about the kind of damage that we had from Dorian, especially from a medical standpoint. You're talking about mobilizing your plans, whatever they are. What is your relationship with NEMA? Again, once Dorian is here, or any other hurricane, but in this instance, we're talking about Dorian. What is your relationship with NEMA? How did that impact how you did what you did?
So we work closely with NEMA all year long. As the Essential Support Function 8 of NEMA, we have had opportunities in the past to lean on NEMA once the health capacity to respond to any particular event would have been, we would have gone beyond our capacity. So the working relationship with NEMA is ongoing. But as it relates to Dorian, certainly as soon as NEMA would have convened the EOC, Health had to convene its EOC as well, and that's a chief responsibility. The decision to do that is the chief responsibility of the Chief Medical Officer.
And so you are down there, NEMA is determining now, Dorian is here, we got to mobilize this, we got to mobilize that. You are in the midst, you as the Chief Medical Officer, are in the midst of whatever those sessions are down there with NEMA, getting ready to respond.
Yes, we are. And when I say we, as in health, convenes our EOC, we have a very good team of persons. And it's a cross-section of persons, physicians, nurses, public health professionals, persons that represent the Public Hospitals Authority. We all come in our EOC, and then we are able to field calls and information that comes directly from NEMA through our disaster preparedness coordinator who sits within NEMA. So we work collaboratively to ensure that we have the best response that we can possibly have as it relates to all health matters during the event as best we can, but particularly in the just in the immediate, once the all clear is given, we have, great responsibility for ensuring that our initial damage assessment persons are actually mobilized with the assistance of NEMA, and those teams are planned. We have those in our plans early on. We just say, please be on alert. We will be calling you as soon as there is an all clear, and they make themselves available to go into the particular areas of disasters for about 72 hours, and then they come back and provide additional information that we are then able to use to continue the response.
And your plans include your team of physicians, nurses across the board from your facility here in Nassau, Grand Bahama, Abaco, wherever they happen to be.
Yes.
All of them would be available to be a part of your team.
Yes, that's how we plan it.
We talk about Dorian, and I guess we'll talk about this forever. The sheer size, the brutality of that system. How did that cause you to revise those plans that you had in place, plans that you have for any disaster? How did that cause you to revise the plans that you had in place for the normal, if you can call it that, disaster?
Well, what I would say is, certainly it's fortunate that this was not our first run. So we were able to build on what we usually do and enhance that. Let me give you an example. As it relates to Dorian, certainly we did not anticipate the level of destruction and the long period that the system actually stayed over both Abaco and Grand Bahama. So once we got the all clear, we knew that it was, it was necessary now to mobilize quickly and to begin to actually receive persons who may have had injuries or who may have fallen ill during the actual event. So we did exactly that, and what we found out is that the airlifts were coming, fast and furious almost, and that's because they needed to come. So we had to organize ourselves down at the airport at Odyssey, and we had healthcare teams there doing the triage in order to be able to get people to the care they needed and the level of care they needed and not overwhelm our system. Because we didn't need everybody going to accident and emergency if they didn't need to go. So we actually kept our Flamingo Gardens clinic open so that those that only require that level of care could just be sent there. So we had to augment, because that's something we had not really done in the past, but we'd never had that level of airlifts coming in so quickly.
And I imagine that must have strained your resources to the max, for lack of a better description.
I think we did have strain, but one of the good things is that we had not just public sector, we had private sector individuals, healthcare providers, we had the EMS persons from doctors, and everybody came together, the Red Cross, just to make sure we had enough ambulances there to transport persons and to do the triage that we needed. But it was taxing, but necessary.
We got to take a break, but before we take this break, explain triage for those who don't understand what that means.
Triage means that you do a cursory review of a person. That is, and I'll speak specifically to this Dorian, but persons being flown in, they needed to be assessed, get vital signs, look to determine what the injuries were, the level of injury. Would it require hospital care? Would it only need, cuts and bruises? They probably could just be seen in a clinic. So that's the kind of triaging that we would have done at Odyssey.
Okay, we got to take a break, and we're going to continue this. Speaking with the Chief Medical Officer of the Bahamas, Dr. Pearl McMillan. We'll be back after this. Welcome back. You're watching A Closer Look. I'm Anthony Newbo, speaking with the Chief Medical Officer of the Bahamas, Dr. Pearl McMillan. Dr. McMillan, we're talking about you handling the influx of injured from Abaco primarily, some from Grand Bahama, but Abaco primarily. Also had to handle the deceased bodies as well, and that is one of the concerns being expressed by a lot of people, how that whole process is being handled. What can you tell me about that?
Well, certainly before I get into the process, I would publicly like to say I give my condolences to persons who would have lost relatives, friends, associates, and to those who are still dealing with the whole missing persons. But what I would say about it is this is a multi-agency response, and the laws of the country pretty much guide how we are able to move forward during each of the steps of the process. As it relates to recovery of any deceased or remains, certainly that is in the hands of the police. And health has a responsibility to work closely with all of the agencies for the best, the best possible and the quickest process that we could actually have to sort out all of the deceased and the missing persons that we are unfortunately having to deal with now. I have had 1 or 2 meetings with both the police, coroner, the pathologists, and I guarantee the public that we are all working closely together to be able to bring the best resolution to our situation as it relates to the deceased and the missing persons in the shortest time possible. However, I would put a caution there because of the sheer amount of damage, and I've been to Abaco twice now since the hurricane, and recovery is difficult, in part because of just the amount of debris, and so it's going to take some time for us to actually move through each of the processes. And I would ask persons to, be patient with the process, and let agencies know, like if you're missing somebody, please let the police know that that individual is missing. I saw on NEMA's website, there's a number that you can contact, and I know the Central Detective Unit has a desk that you could actually contact, because that helps to begin to narrow down who is truly missing.
Yes.
And gives us the opportunity then to begin to process those who have been recovered,
right.
And be able to match those to relatives, friends, as best we can.
And so your long and short is you have the process in hand, and you're following the process as best you can.
Yep.
And you're comfortable with that.
Very comfortable.
Something else that people have expressed some concern about, not overwhelming, but some, the possibility of the transfer of diseases. Do you have that concern, given what you know about what is going on?
Well, certainly the possibility of disease transfer is, in any what you would call disaster situation, is high on our list of concerns. And because of that, it's something that we place in our plan early on, how we would begin the surveillance. We work closely with the Department of Environmental Health Services, which has the responsibility for dealing with environmental conditions that could potentially cause human health concerns or illnesses. So we work closely with them to monitor water, sanitation, whether or not there is the potential for vector-borne or mosquito-borne illnesses. And then our disease surveillance unit, which is always, is always functioning. We have enhanced our surveillance capacities. That being, we are actually asking for all healthcare providers, be it in the public sector, private sector, those who are volunteers. We have provided them with a template for them to report on particular syndromes. So if anybody shows up with a fever and rash, or if anybody show up with a history of diarrhea, we need to know. So we monitor that on a daily basis to determine whether or not we have any real concerns. And to date, we are fortunate that we have had, a few reports of, a few diarrhea, a few, fever. But when we take samples from those persons, we've had no confirmed cases of any infectious disease that is of concern related to this Dorian.
Dorian, yeah. Your facilities in Abaco, most of them are wiped out, if not all, huh?
Well, what we've had is certainly, and I think this is a blessing, our major facility in Marsh Harbor actually stood strong. Okay. It actually became a shelter for many of the persons who would have lost their homes. So in the immediate, we had, as I understand it, close to, I think, 1,000 persons actually sheltering in our clinic. So I'm thankful that that building actually stood strong. We have a little leaking there, but we have now been able to, clean it out and get back to healthcare services delivery as normal. Cooperstown, which is our next major clinic in Abaco, has had some roof damage and a couple structural things go on. And we are in the process of, beginning to assess and move forward with actually fixing those things. And then we have a number of keys where we had smaller clinic services, which are really serviced from the mainland.
Yeah.
But because of the difficulty with actually getting to those areas, what we have had to do is we utilized a number of our emergency medical teams, which we would have allowed to come into the country to assist. They would have begun to provide care in a number of the keys, and even in our Foxtown clinic, they would have assisted, in part because, if you recall, there was a separation between, I think, on the northern side between Cooperstown and Foxtown. So we couldn't move easily our healthcare providers. So we got assistance from a number of the emergency medical teams that we were able to source through the Pan American Health Organization mechanism. And they did wonders for us. They allowed our people to be able to, deal with what they're dealing with. As many of their homes, many of their, missing persons, they were able to actually step back and do that. And now we are in the process of beginning to actually populate as best we can our healthcare services on the mainland with persons from New Providence, but we plan to augment that with additional volunteer relief services.
Okay, we've been talking about Abaco, want to talk about Grand Bahama, but we got to take a break, and we'll be back with more of a closer look and Dr. Pearl McMillan after this. Welcome back. You're watching A Closer Look. I'm Anthony Newbo speaking with Dr. Pearl McMillan. She's the Chief Medical Officer of the Bahamas. We've been talking primarily about Abaco, but Grand Bahama had some damage as well, lots of damage. What about your facilities in which you've been able to do in Grand Bahama?
Well, certainly the Rand Memorial Hospital had significant damage, and it required that pretty much that hospital had to be, different components had to be moved out of the facility. And in the immediate, there were a number of other private healthcare services that was able to accommodate components. But now we have Underground Samaritan's Purse, which is one of the groups that is an emergency medical team. And they are providing services to the level of, hospital care, actually to assist the Grand Bahama Health Services to continue the care that they need to provide during this period. And certainly the east end of Grand Bahama, many of their clinics were just destroyed. So that is going to be an area that requires focused attention to
long term.
Yes. In the short term, we also have a medical team that is visiting, that is providing care. on that side as well. But there will need to be a long-term plans for how we will actually reconstruct those facilities and also, get the RAN back up running properly and possibly even get a new hospital in Grand Bahama.
This is the time to plug it.
Yes.
Whatever you're doing, you kind of almost have to operate on a parallel track because you're dealing with Dorian, but you still got these two major healthcare facilities that you got to deal with, and the rest of the healthcare facilities, the clinics, wherever they are in the Bahamas. How are you able to do that? A challenge.
It's challenging, but I believe healthcare providers, and that includes, physicians, nurses, the admin, all categories of staff. I believe they recognize that this is a time when we have to come together and support the response, and we've had very good response from all categories of staff.
How are they holding up, by the way, as you're talking about the staff? How are they holding up? Because I imagine they must need some counseling too.
Yes, and certainly all of the teams that I would have mentioned that we would have sent out, once they come back, they do a debrief and they are linked directly to counseling services. All of our healthcare providers who we brought in from the affected islands, they are immediately linked to counseling services. The Sandilands Rehabilitation Center is truly coordinating that along with the Bahamas Psychological Association. They're working together to ensure that we are able to provide the necessary psychological services in the immediate, but we are also planning for how we will expand our capacities to do it, because we recognize that this is a huge component of this disaster. There's going to be a need for ongoing support, and individuals will need to be able to, call into a hotline, which we will have up and running shortly. So listen for the name. We will put it out in social media and other media. And also we will be using a surveillance mechanism that we generally use at healthcare facilities to be able to identify persons early on, for depression and other things that could actually signal that there is a need for more care.
Where are you right now, today, in terms of your overall plans to manage the aftermath of Dorian? You comfortable with where you are and being able to execute those plans that you put in place?
I believe we have done a good job to date as it relates to the immediate short term, and now we're moving into like an interim period toward a longer term recovery and actually repairs and response. So what we are doing, we are taking a minute to actually look at all the data we have gotten, look at where we are, and we're putting together a plan, actually working on it as we speak, to actually move all components forward: the surveillance, the psychosocial support, the need for additional relief staff, relief groups. What is our capacity as it relates to healthcare providers? What do we need, and how do we match it with all of the volunteers that we have been processing? So I say that to say there's a little overlap with each of these, but as we move from each phase, we are actually following a plan and looking at all of the key components of what a response will need to have in it. And I am confident that we will continue to provide what is necessary from the health perspective. And when I say health, I say it in the broadest terms. When we talk about the environmental component, they are all determinants of health. Yeah. So we will work closely with those agencies to ensure that we do what is required for the best outcome for those affected and those who, directly or indirectly.
You're doing all that you can to ensure that you service people and help them to get through the aftermath of Dorian. What do you want people not to do? There's some things that people do that contribute to their not being well Bad behavior is one way to describe it. There's some things you want to say to people. Listen, don't do that. If you get there, we suggest you follow this path.
Okay. Certainly for those directly affected or impacted by it, there is that, the tendency is to, just dwell on it, and that could lead you to a place of hopelessness. But try, do your best not to go down that road. And it's difficult saying that to somebody who is in it, who has lost family, lost friends, lost a house, lost, comforts. But what I would suggest to that grouping is that talk to somebody, lean on somebody. We have social services, we have the psychological support available. The Ministry of Health is here to assist you through any of our community clinics, any of our hospitals. We are going to provide access to that other level of care, but in the immediate, just don't sit there and feel as if you're alone, because you're not alone. As it relates to persons who, in that grouping still, who would be going back to their, I know there will be people who want to go back in the immediate and start to do the recovery. Be careful. Ensure that you have all your, vaccinations up to date to prevent, tetanus and those things that can actually occur, and try to do it as safely as possible. But also know we have healthcare services available on those islands, and we are there to assist you. Just show up if you need any care. And for persons who have the tendency to, start, rumors about things that are not factual, that is something that we are definitely asking that, you do not do it. The Ministry of Health, and I would even say the wider government, is actually coordinating a response that is, I believe, very, very coordinated and moving in a direction of positive outcomes. So let us all collectively and individually, assist after, in the aftermath of, I think, the worst disaster that certainly I have ever seen. And I asked my dad, who is 82, Daddy, have you seen anything like this before? And he was able to say no. So I think this is something that we all collectively have to come together and do. And let's just help each other to get through.
Thank you very much. I'm sure a lot of people will be helped with the information that you gave me today. Thank you again. And thank you for watching A Closer Look. I'm Anthony Newbold. Remember, you can watch us on Facebook and on YouTube.